Life moves fast, and we often miss small but important changes in our aging loved ones. These subtle signs can indicate that they are nearing the final stage of life. Recognizing them early allows us to offer better care, comfort, and dignity in their last days. As the body weakens, certain physical and emotional changes become noticeable. These signs may seem like normal aging, but they could indicate a deeper decline. Understanding them can help us provide the right support at the right time. There are 7 key signs to watch for, including weight loss, extreme fatigue, appetite loss, social withdrawal, breathing changes, confusion, and increased pain. If several of these appear together, it may mean the body is slowly shutting down. If you have an elderly loved one, pay close attention to these changes. Talking with them and their doctors can ensure they receive the best care. Simple gestures like holding their hand or spending more time with them can bring them comfort. By recognizing these signs, we can make their final stage as peaceful as possible. Awareness allows us to provide love, support, and dignity, ensuring no regrets in their last moments. Number 1. Unexpected weight loss. Losing a significant amount of weight without trying can be alarming. It is not just about eating less, it often points to deeper health concerns. Our bodies rely on a balance of nutrients, and when this balance is disturbed, it can lead to unexpected weight loss. Many people assume that losing weight is a good thing, but if it happens too quickly and without an obvious reason, it could signal something more serious. As people age, their metabolism naturally slows down, meaning they burn fewer calories than before. Along with this, appetite may decrease, making it harder to get enough nutrients. When the body doesn't receive the energy it needs, it starts breaking down muscle and fat reserves for fuel. This can lead to frailty, making daily activities more difficult and increasing the risk of falls or injuries. A weak body is more vulnerable to infections and illnesses, which can further speed up the decline in health. Unexplained weight loss can sometimes be a sign of hidden medical conditions. Serious diseases like cancer, kidney or liver failure, and other chronic illnesses can cause the body to lose weight rapidly. These conditions often go unnoticed in the early stages, as symptoms may not be obvious. By the time significant weight loss occurs, the disease may have already progressed, making early detection crucial. Malnutrition is another possible reason for weight loss. If someone is not eating a balanced diet, their body might not be getting the nutrients it needs to function properly. This is especially common in older adults or people with medical conditions that affect their ability to eat or absorb food. Over time, this lack of nutrition weakens the body, affecting everything from muscle strength to brain function. If drastic weight loss occurs without a clear reason, it is important to see a doctor. A medical professional can run tests to identify any underlying issues and suggest a treatment plan. Catching health problems early can make a huge difference in managing them effectively. Taking care of nutrition, staying active, and paying attention to changes in the body can help prevent serious health complications in the long run. Number 2. Extreme fatigue and weakness. As people grow older, they often feel more tired than they used to. However, if an elderly person experiences extreme fatigue that makes it difficult for them to get out of bed or do simple daily activities, it could be a serious concern. This kind of exhaustion goes beyond normal tiredness and may indicate that their body is slowing down. They may find it harder to stay awake, move around, or even respond to conversations like they used to. One possible reason for this extreme weakness is that the body's vital organs, such as the heart and lungs, are not working as well as before. The heart may struggle to pump blood efficiently, leading to poor circulation. When the blood flow decreases, the body does not receive enough oxygen and nutrients, making a person feel constantly drained. Even after rest, they may not regain their energy. Additionally, the lungs may not be supplying enough oxygen to the body, further contributing to weakness and fatigue. Oxygen is essential for keeping the body's cells and muscles active. When oxygen levels drop, simple activities like sitting up, eating, or talking can become exhausting. The person might also breathe more slowly or appear to be struggling for air at times. This extreme fatigue can also affect a person's mental state. They may become less alert, confused, or uninterested in their surroundings. Since the body is using most of its energy just to keep basic functions running, there is little left for movement or social interactions. Family members may notice that their loved one is sleeping more and responding less to conversations. Overall, when an elderly person experiences severe tiredness that prevents them from doing even the simplest tasks, it could be a sign that their body is beginning to shut down. It is important for caregivers and family members to monitor these changes and provide comfort. Seeking medical advice can help determine if any treatments or supportive care can ease the person's discomfort during this time. Number 3. Significant changes in appetite and thirst. One of the clear signs of a body slowing down is a major change in appetite and thirst. A person may suddenly eat much less or even stop eating altogether. This happens because the digestive system is not working as efficiently as before. The body no longer needs as much energy, and food may not be processed the same way it once was. As a result, a person may refuse meals or only take a few bites before feeling full. Similarly, thirst can also decrease significantly. A person may no longer feel the urge to drink water or other fluids as often as they used to. This can happen because the body is not signaling the need for hydration in the same way. When someone drinks less, their body may become dehydrated, which can lead to other issues like dry mouth, weakness, or confusion. Dehydration can make the situation more serious as the body relies on fluids to function properly. The slowing down of the digestive system means that food and water are not processed as efficiently. This is why eating and drinking can become more difficult. Some people may even experience discomfort when they try to eat, leading them to avoid food altogether. In such cases, small amounts of soft foods or sips of water can be offered to keep them as comfortable as possible. However, forcing food or drinks is not recommended, as the body may not be able to handle it well. It is important for caregivers or loved ones to recognize these changes and respond with care. Instead of insisting on full meals, they can offer light snacks, ice chips, or small sips of water. Keeping the person comfortable is the main goal, rather than pushing them to eat or drink more than they can handle. Using lip balm or moistening the lips can also help with dryness caused by reduced fluid intake. Overall, a significant decline in appetite and thirst is a natural part of the body slowing down. It is a sign that the body is conserving energy and shifting its focus away from digestion. While it may be concerning to witness, providing comfort and support is the best approach. Understanding these changes can help loved ones provide better care and ensure that the person remains as comfortable as possible. Number 4. Cognitive decline and confusion in the elderly. As people age, it is common to experience some memory loss or forgetfulness. However, if an elderly loved one suddenly begins to struggle with remembering things, becomes easily confused, or has difficulty recognizing familiar people, it may be a sign of something more serious. These changes can happen quickly and may be more than just normal aging or dementia. Instead, they could indicate a deeper health issue that needs attention. One possible cause of sudden cognitive decline is a reduction in blood flow to the brain. The brain needs a steady supply of oxygen and nutrients to function properly. When blood circulation decreases, brain cells may not receive enough oxygen, leading to problems with memory, thinking, and recognition. This can make an elderly person seem lost, forgetful, or unable to respond appropriately to their surroundings. This decline in brain function is often a warning sign that the body is entering its final stages of life. As organs and systems begin to slow down, the brain is affected as well. The person may have trouble communicating, remembering important details, or recognizing even their closest family members. These changes can be distressing for both the individual and their loved ones. It is important to monitor any sudden shifts in cognitive abilities and seek medical advice as soon as possible. A doctor can help determine whether the symptoms are due to a treatable condition, such as an infection or medication side effects, or if they are part of a natural decline. Understanding the cause can help caregivers and family members provide the best possible care and support. While cognitive decline can be difficult to witness, being aware of these signs allows families to prepare emotionally and practically. Providing comfort, reassurance, and a calm environment can help ease confusion and distress. In the final stages of life, emotional connection and compassionate care become even more important in ensuring the elderly person feels safe and supported. Number 5, withdrawal from social interactions. When a person who was once lively and enjoyed socializing starts to become quiet and distant, it may be a sign of emotional or physical decline. This change can be concerning for family members and friends who notice the shift in behavior. The person may no longer show interest in conversations, gatherings, or activities they once enjoyed. They might avoid answering phone calls, replying to messages, or even spending time with loved ones. One reason for this withdrawal is that the brain begins to focus on conserving energy for essential functions. As the body or mind weakens, social engagement may feel like an extra burden rather than something enjoyable. People experiencing this change may feel physically exhausted, mentally drained, or emotionally detached. Simple conversations or social interactions that once felt easy may now seem overwhelming. In some cases, withdrawal from social life can also be linked to feelings of sadness, anxiety, or depression. A person may not want others to see their struggles, so they isolate themselves. They might feel like they have nothing to contribute to conversations or that their presence no longer matters. This emotional distancing can create a cycle where loneliness makes their condition worse. Additionally, physical health issues can contribute to social withdrawal. Chronic pain, fatigue, or illnesses that affect mobility can make it difficult to participate in social activities. A person may prefer to stay alone rather than struggle with discomfort in social settings. Changes in cognitive function, such as memory problems or confusion, can also make socializing difficult and frustrating. Recognizing social withdrawal as a possible sign of decline is important. Friends and family can offer support by being patient, checking in regularly, and creating comfortable, low-pressure opportunities for interaction. Even small efforts, like a short visit or a kind message, can help a person feel valued and less isolated. Understanding and responding with care can make a significant difference in their well-being. Number 6. Changes in breathing patterns. When a person is approaching the end of life, their breathing often changes. It may become shallow, meaning they take in less air with each breath. Their breathing may also become irregular, with some breaths being deeper or quicker than others. Sometimes there are long pauses between breaths, which can be concerning for caregivers and loved ones. These changes happen because the body is starting to slow down and the respiratory system is not working as efficiently as before. One common breathing pattern seen in the final stages of life is called Cheney-Stokes breathing. This is when a person's breathing cycles between deep breaths and very shallow or no breathing at all. The pattern repeats over and over. At times, it may seem like the person has stopped breathing entirely, only for them to take a deep breath again. This type of breathing happens because the brain is not sending consistent signals to the respiratory system. Labored breathing is another sign that the body is struggling. The person may seem to be working harder to breathe, with their chest moving up and down more forcefully. They may also make gurgling or rattling sounds while breathing, which happens when mucus builds up in the throat. While this can sound distressing, it is usually not painful for the person experiencing it. Caregivers can help by keeping the person comfortable and adjusting their position. These changes in breathing are natural as the body prepares for its final moments. The pauses between breaths may become longer, and eventually breathing will stop completely. This process varies from person to person, with some experiencing these changes for hours or even days before passing. It is important to provide comfort and support during this time rather than trying to force normal breathing patterns. Understanding these breathing changes can help loved ones feel more prepared. While it can be difficult to witness, knowing that these patterns are a normal part of the dying process can provide some reassurance. The best thing caregivers can do is keep the person comfortable, speak to them gently, and offer emotional support. In many cases, healthcare professionals can guide families on how to manage these changes and ensure a peaceful passing. Number 7. A sudden burst of energy before the end. One of the most confusing signs that a person is nearing the end of life is a sudden surge of energy. This unexpected improvement can be seen in elderly individuals who were previously weak, tired, or unresponsive. They may suddenly become more alert, engage in conversations, or show an increased interest in their surroundings. This change can give their loved ones hope that they are recovering, but unfortunately, it is often a temporary phase. During this brief period, some people may regain their appetite and eat more than they have in days or weeks. They might ask for their favorite foods, laugh, or even sit up and participate in activities they had been unable to do before. Their mood may seem brighter, and they may appear more at peace. Family members may believe that the worst has passed, but this phase is usually short-lived. What many do not realize is that this surge of energy is actually a part of the natural dying process. It is the body's final effort before it starts shutting down completely. Medical professionals often refer to this as the rally phase. It can last for a few hours or even a day, but soon after, the person may become extremely weak, unresponsive, or slip into unconsciousness. For families, witnessing this burst of energy can be emotionally overwhelming. They may feel hopeful, only to be met with deep sorrow when the decline follows shortly after. This is why it is important to understand that this phase is not a sign of recovery. Instead, it is an opportunity to cherish the last moments with their loved one, offer comfort, and say any final words they wish to share. Recognizing this phenomenon can help families prepare emotionally and make the most of the time left. Rather than feeling false hope, they can use this period to provide love and support, ensuring that their loved one's final moments are peaceful and filled with warmth. Understanding this natural process can ease some of the emotional pain and allow families to focus on making meaningful memories. As our elderly loved ones approach the final stage of life, there are subtle but important signs that can help families understand what is happening. These signs may not always be obvious, but recognizing them early can help us prepare both emotionally and practically. It is important to be aware of these changes so we can provide the best possible support during this difficult time. When we notice these signs, we must focus on providing comfort, love, and proper care. At this stage, medical treatments may not always be effective, but emotional support can make a big difference. Spending time with them, speaking gently, and ensuring they are not in pain can bring them peace. Small gestures of care, like holding their hand or playing their favorite music, can help them feel loved and comforted. Understanding these changes also helps families mentally and emotionally. Prepare for what is to come. Watching a loved one decline can be heartbreaking, but being aware of what is happening allows us to cherish the remaining time with them. Instead of feeling helpless, we can focus on making their final days as peaceful as possible. It is also important to ensure that they receive proper medical and emotional care. In some cases, hospice or palliative care can provide the necessary support for both the patient and their family. These services focus on reducing discomfort and improving the quality of life rather than prolonging suffering. Having professionals guide us through this stage can ease some of the burden. If you notice any of these signs, do not ignore them. Sometimes families may avoid facing the reality of a loved one's condition because it is too painful. However, acknowledging these signs allows us to take necessary steps, whether it is saying final goodbyes, fulfilling their last wishes, or simply being present for them. Awareness in these moments can make all the difference. It allows us to act with kindness, patience, and love, ensuring that our elderly loved ones do not feel alone. Even if words are not spoken, they can feel our presence and care, which brings them great comfort in their final journey. In the end, our goal should be to give them peace, dignity, and love. Recognizing these signs, preparing ourselves, and providing compassionate care can help make their transition as smooth and gentle as possible. Though it is a painful experience, it is also an opportunity to express our deepest love and gratitude for them.